Hi, this is John O with Affinity. In this educational video, we'll be discussing strategies for businesses that already have group health coverage. This presentation assumes that you've watched our videos entitled Impact on Health Insurance, Parts 1 and 2. Today, we'll be reviewing two case studies. First, we'll look at how the health benefit exchange can generate cost savings simply by introducing the employee choice model. In the second case study, we examine a situation where the individual mandate causes non-participating employees to sign up for group coverage. As you can imagine, this results in a significant increase in employer costs. We'll see how the health benefit exchange can soften the financial blow by leveraging both the employee choice model and new employer contribution options. So let's dive in and begin with case study number 1. Here we've got a small business with 4 employees. Everyone participates in the group health plan. The employer covers 60% of the premiums. Current coverage is with Oxford Health Plans. There is one product, the EPO. As indicated on the table, there are 2 families and 2 singles on the group plan. Let's assume that this particular EPO has a cost share arrangement that's equivalent to a gold plan. A gold plan has reasonably low copays, deductibles, and coinsurance. Now, in switching to the health benefit exchange, our employer decides to stay with Oxford and not offer other insurers. Next, our employer selects gold, silver, and bronze metal tiers, or cost share arrangements. The 2 employees with family coverage choose gold, which is equivalent to their current insurance. However, the 2 employees that have single coverage choose bronze. Perhaps they enjoy excellent health and are budget conscious. The end result is that employees buy what they need, not more, and the employer and some of the employees save money. Now obviously this is just an illustration, and the buy down doesn't always happen as we've just presented. Sometimes it's less, other times maybe more. Our goal with this case study is simply to present the opportunity and stimulate some thinking. Let's move on to case study number 2. We've got the same size business, 4 employees, but this time only 2 employees participate in the group plan. However, the individual mandate drives the 2 non-participants into seeking group coverage. This is going to be a big problem for many small employers, especially those that contribute a lot to premiums. Strangely, no one else is talking about this important issue. In our example, the 2 non-participants are single, so the cost of coverage is much less than for family. Still, adding these 2 employees to the group coverage increases the employer's total contribution by 32%. So what choices do employers have? Well, option 1 is to fully absorb the cost. We think only a small percent of businesses out there can afford to do this. Option 2 is to buy a cheaper product. The employer can increase cost share or switch to a smaller provider network. With both options 1 and 2, the employer can also reduce contributions. However, reducing contributions without providing any offset or choice is not a smart strategy in our opinion. And that's where option 3 comes into the picture. Healthcare reform is here. There are positives and negatives to this law. For buyers of insurance, the health benefit exchange is definitely one of the positives. With choice and flexibility, small employers can design a much more effective health plan than ever before. We talked about what choice and flexibility means in a previous video, but let's do a quick recap. As you know, health insurance is very expensive, so the first thing customers need is a wide selection of products and price points to choose from. Second, the health benefit exchange provides employees with choice. The fundamental premise here is that employees will buy the most appropriate product and not buy more than what they need. The result is that both employees and employers save money. Third, employers have increased flexibility in how they contribute to premiums. A well-thought-out contribution structure will reinforce smart decision-making on the part of employees. So what does restructuring a health plan entail? Essentially, there are 3 steps. First, the broker and employer should discuss priorities, evaluate options, and decide on a health plan leveraging the health benefit exchange. Employee choice will drive the healthy and budget conscious to select a lower price product relative to the current offering. And moving from a flat % contribution to a cap % will put a ceiling on contribution levels. Second, the employer should have a discussion with the employees about healthcare reform and the upcoming changes to their health plan. The employer should also initiate the education process. In particular, the employee choice model will require some explanation. Your broker should provide guidance and support in this area. Support will likely be in the form of communication guides and educational materials. Third, the broker should interact with employees and continue the education process. The broker then helps with plan selection and enrollment. This interaction between the broker and employees is critical, especially during the first year on the exchange when many employees will need some handholding. In conclusion, we believe that the health benefit exchange will dominate the small group market in New York. The advantages, once understood, are undeniable. The exchange is something every small business should consider. If you would like some assistance in designing your health plan, we're here to help. Thanks a lot for your attention, and please consider leaving a comment. We appreciate the feedback.